Hey guys, welcome back to our channel. Today we're going to be doing a debate. This is just like a generic debate that we decided to speak about because I think recently in the parliament this has been a topic that's been discussed. So the topic is, should euthanasia be legalized? Emily and Ellie are saying yes, it should be, and Grace and I are saying no. Yeah, they were saying no.
Yeah, yeah.
So let us begin. Who wants to start? Oh, before we do start, make sure you guys like, subscribe, hit that notification bell, and leave a comment down below of what debates you guys want us to do. And check out other videos as well, whether that be reactions, reviews, or other debates. So who wants to start? Go ahead, Emily.
Okay. Okay. I think maybe just as a quick disclaimer, this is just purely a debate. These
Hmm.
views are
Yeah.
views that we personally might not agree with or not, but definitely someone out in the world does. Yeah, it's just
It's
a
just a
discussion.
yeah, it's just a discussion. Please do not take this as our full 100%. This is how we feel about the situation. I feel
Mm.
like we're all kind of it's very grey area. Don't scream at us for it. We're just debating and having a conversation. Thank you.
I think before we start, I think we need to define a few things. So, to start with, assisted dying. So, there are quite a few different definitions there, but to keep it short and concise, assisted dying is when a person who is terminally ill receives lethal drugs from a medical practitioner, which they administer themselves. So you can sort of think of assisted dying as being at the top of the pyramid with two branches coming down from it, which are assisted suicide and euthanasia. So assisted suicide is intentionally helping another person to end their life, including someone who is not terminally ill. This can involve providing lethal medication or helping them travel to another jurisdiction to die. And then on the other side, you have euthanasia, which is our focus for this debate. This is the act of deliberately ending a person's life to relieve suffering in which a lethal drug is administered by a physician. Patients may not be terminally ill. And euthanasia can be split into voluntary euthanasia and non-voluntary euthanasia. So this debate will focus on both. We'll just focus on euthanasia in general. So voluntary euthanasia is with the consent of the patient, and non-voluntary euthanasia is without the consent of the patient. So I think it's just very important because there's a lot of different terms, but we're sticking to just euthanasia, though it does have a bit of an overlap. And it's legal in some countries already, like the Netherlands, Belgium, Switzerland, and also in some US states. So it's something that is happening out in the world. And Tess already mentioned it is being talked about in Parliament at the moment for it to become legalized. So my reason for saying yes, it should become um, legalized is to do with quality of life. It's choice. And it depends because everybody has a different reason for wanting it. Perhaps their quality of life is not as good as it was before, or perhaps there's certain things that are happening in where they just need it. So it's basically choice. It's the choice of that option being there for whether they want it or not. And we should have the choice of whether when we want to die and how we want to die. Because some people are in such suffering that sometimes they need to, and it's just up to that. Like, how much enjoyment and fulfillment is a person getting given their physical state and mental health in certain conditions? Perhaps is life worth living? Is bringing about death preferable? And should someone who is living with a deliberating or painful terminal condition have to be compelled to live until they die naturally? Is that fair when there is an option? I think I'll stop there. I've got a few more points, but basically it's about choice, giving that choice for people to actually make that decision themselves. Now, that doesn't mean that everybody should have it, and that's where you have to talk to people who are licensed, and they need to also see that you're in the right mind state and you're not just doing this, I don't know, just as an easy way out in a sense, and that it's actually something that is necessary. I don't know.
Mm.
Necessary doesn't seem like the right word, but is the right choice.
Slightly agree, Emily. I do see from your point of view about it's their choice about whether they wish to die or not. But I do think that this can be misused from some people. Like they say this is a practice of ending life of a patient who's at a limit of beyond suffering. But the question we should be asking is that it depends on the kind of suffering these patients are going through, like who's in a coma, or maybe someone who has cancer possibly. But if it's like, if anyone can use it, what if it says like someone who has depression or has HIV that can easily be treated and can easily be looked into by extra help. But if I know you said it's choice, but if they bluntly ignore these advice or treatments and just decided, no, I can't live like this, I want to die. I know they say they can't see it on quality of life, but this is like seeing an easy road, like they can go straight down and never return, and no one has granted them another second option. So yes, it's a choice, but this is kind of giving them a narrow choice. Like this is like the only option. So I don't know. I feel like this is like something for people who may have depression again, or maybe is in not so much pain, but is in quite a pain, and but they don't have a clear head about treatments or any help that they can get easily, and just think, if this is an option, I can take it, I can use it to end my suffering, but it doesn't have to. So I think it can be misused, and it can made mis and it can may direct people into the wrong direction. So yeah, that's my first point. Like to hear your thoughts.
Yeah, I get what you mean. It's very easy for these kind of stuff to get messed up and mixed up, and for people that shouldn't, for them to get for them to actually be allowed to have that option. I think that's where it comes into, like, it's really important for, well, it's not basically, you don't go to a clinic and go, hey, I want to get euthanized or something. It's not as easy as that. There are loads of different sorry.
I don't know.
Loads of different
Hey,
other steps.
is it okay if I get that tomorrow?
That's
That's what I'm saying. Like you gotta talk to the medical professions and professionals, and they will have a look at your case study and they will see. I mean, it's not as easy, as just saying, "Oh yeah, you deserve it because you've been suffering for 20 years or something." Like it's not as straightforward. They will need to evaluate, make sure that you're in the right mind of state, talk to your doctors and stuff. And yes, I know sometimes, there are ways for this to get missed and stuff, but I think that is where it's on the government to put in something for this to be monitored and for this to be put into practice in a way that is suitable for people, and also takes into consideration their knowledge of the subject, how it works, but also what it actually means. Because it's
yeah,
very good and easy for them to just go, hey, I think tomorrow's the day. I've been suffering with so and so, and
yeah,
sorry, like
Yeah,
basically someone up there, not up there, but someone needs to monitor and make sure that the
Yeah,
right reasons, that they're doing it for the right
yeah,
reasons.
yeah,
yeah. But then you also got to think like then they could use like Grace was saying how that could get then misused. Like people would then say, "Oh, I've got mental health problems," and then say,
yeah,
"Oh, that's like I need to like get out of this place."
yeah,
And then, but then you can say, but then there's obviously treatments for that. You have like therapy, you have maybe medication for that or whatever. or there are people who have like non-terminal illnesses. Maybe there's treatment for that, but they don't know about. So I think they should also be considering all these treatment that are available rather than saying, yes, euthanasia is my option. Like that's what I need to go for. Or
Mhm.
there are people who, I don't know, who have cancer or some sort of like long-term illness and they think they can't live like this anymore and they are going to suffer, but then there could be research that's going to help their condition. It's like they could use that like they could misuse that what's it, euthanasia, and then think
Yeah.
that's my option, which is a very risky move, to be honest. That's
Yeah,
what
Yeah.
I feel.
no, I agree. But again, that's why it's not as simple as just going in and booking yourself an appointment. It's not just a one day even talk with these medical professionals. It's a series of sessions for them to actually make sure that you're the right candidate. I don't want to say it
You're
like
in the
that,
right
but
you're
you're
in the
Mm.
the
right mind, like this
yeah,
is your.
yeah,
Yeah, how
and
do you yeah, sorry, I was just gonna ask, like, how do you determine if they are in the right mind?
Yeah, because I was just gonna say, like, if I was like if I was depressed, like just I was just feeling really, really sad, and I have a good life, but I just feel like I don't feel I want to live anymore. And if that's not a good reason, then I could just lie about it and just tell them I've suffered abuse. Like people could just lie about these things because they just want to end it all, and that could really like tempt someone or really get them to just make up a fake stories or like just tell a great lie about about suffering that they're not actually suffering through, but they are in bit of pain, but not in great suffering, and they still are lying about it just so they can get this option. So,
And also like with doctors, like they take an oath, like whoever it is or whatever the condition is, they have to save them. But if it's euthanasia, they're doing the opposite. But then at the same time, it's what they want, but they also want to save lives.
so would you
So
say a DNR, do not resuscitate, is that a form of euthanasia? Because to me, that is sort of a form of passive euthanasia. It's intended to prevent unnecessary suffering. So you're in a condition where, I don't know, you've lost your pulse or something, and you've put in a DNR. In a sense, you have given that option, even though perhaps if they did resuscitate you, you could have survived, you could have had a great life. I mean, it depends on each person, like no person is the same. But already, in a sense, this is already in practice. I think a DNR is pretty much it's on that same sort of level as euthanasia. So it's already there, and doctors are doing it. It's up to you. Again, it's choice. If you choose not to have it, to be resuscitated after something's happened, then that's it.
hmm,
About your point, Grace, about people lying and stuff. Yeah, that can happen, but again,
hmm,
that can just ruin euthanasia for everybody, and that's a shame because some people will really want it, and for their reasons, I don't know, maybe they've been suffering for so long, maybe they just can't handle it anymore. Like I've like seen stories and stuff. I can't remember if it's real or not, but of this woman in the UK, and her husband had some sort of condition. I can't remember what it was, and then she ended up getting a condition herself, and she saw how bad like each time like over the years his condition got, and she didn't want to have that happen to herself, so she went to Belgium or something, and she got euthanized. So it's really difficult because some people can ruin it for the people that do need it. But again, like I think this is where it's just really difficult. Do you focus on the minority or do you focus on the majority? And yeah, there's always going to be that little bit of, oh, but they could be lying, oh, this, that, that. But
hmm.
it's very difficult because it's sort of not allowing people who might actually really need it, want it, or really deserve it to have that choice. And I think that's really what my argument comes down to is choice, having that choice. And not everybody should have that choice. But there are definitely some people that do deserve that choice, because I can't imagine myself, I don't know, lying in bed for 20 years, suffering so much, and just being told, oh yeah, suffer for another 20 more. It's fine, you know. It's very horrible. I don't know. Whenever you're given a choice, it can always end up with a bad result, but it can also end up with a good result. So it's
Yeah.
really difficult. This is why this whole argument about euthanasia is really difficult, because there are both sides to it, and it's just about the people, I guess.
Yeah. Yeah. Another point I have is that it can be misleading euthanasia, because I remember a while ago I watched this documentary that starred one of the actresses from Silent Witness called Liz Carr, who's on the wheelchair and she's disabled, and she was talking about assisted suicide as well, because if you remember the film Me Before You, there's a character who's on a wheelchair, and spoiler alert, but he wanted to die as well in that sort of thing. So it's kind of like telling people, like, if you're disabled or if you're not in that ideal average like life that many people have, then it's not worth living. So I think if, like, say if they advertise it badly on media or like films, television, anything, then that could mislead people from any background, whether you have a disability or whether if you have like a mental problem. It can tell you, like, if you got this, then life is not worth living. So, like, I get what you mean, Emily. It can be helpful for people who are in pain as well, but it might mislead people as thinking, if you're in a similar pain, this is what you should get before this stage happens. So it's a it's a dangerous thread to walk on, and it can that many people, and it kind of may twist people's minds about, is their lives worth living, or like,
Yeah, exactly. They'll probably think that they all have the same outcome. Not everyone is the same. So
yeah.
then, yeah, exactly. So they might think like, my life is not worthy enough, and I should do what everyone else is doing because that's what they've done.
Yeah, exactly. So I forgot to mention that the documentary she was in, it was called Better Off Dead. It's really good, really sad, but really interesting to know. But yeah, so it can be misused and it can be misleading, is what I would say for euthanasia. Sorry.
I think I'll let Ellie talk now. I've been doing quite a
Yeah.
bit.
Okay. So obviously, kind of going back a bit, but like what you said, I feel like if it was to happen, it needs to go through so many different things before it can get to that point to like qualify for it, I guess. Like there needs to be proof, I guess, in some ways that you've tried everything else. So if it's like a mental health issue, then you've tried going to doctors, getting prescriptions from them, you've tried therapy, you've done this, you've done that. At the end of the day, it is the last option, not the first. So there needs to be proof that you have gone through all of this. And then even before it's like, oh, okay, you've gone through all of this. Here, take this. It's okay, I know you've gone through all of this, but let's see what else we can do, rather than it just being, okay, sure, you've tried, have the last option.
Also, so you just brought something up that just got me another another point. So if someone's like someone with a medical degree is looking through like your reasons and your points about wanting to die, who are they to decide your life? Because I know what you said, it's a choice, but they are also meddling in and like judging your decision. So maybe one of them, like maybe someone who might understand your reason and might agree, or someone who doesn't understand and still agrees. Like if I went up to them and said, I have depression, I want to stop living. And they'll be like, okay, you can do it. It's like that's also playing God. And you're not only putting your life on the line, you're also giving them like, so I don't know how to word it. It's just
Yeah,
like you kind of, I think I hope you understand what I mean, but that's a bit kind of sick and a bit dark
There's too
thinking
much
that
power
you're
to put
asking
on someone.
someone who you don't kind of know, and they might have I don't know, you don't know how well medically, how well they know about if you, how well, like your reasons are, like if they're good reasons. And yeah, so I don't know, I would be worried for that patient if they don't have enough good reasons and the doctor still decides. So like it decides they are allowed to die. So that's a bit twisted.
yeah, I agree. You've got to think about moral ethics, religious, all that points. Like just because you have like a medical degree and you have so many years of experience, I don't think it gives you that power or position to just say yes, you have the consent to
Mm,
um like end your life if you want to. But then you also think like the outside perspective, not from just the patient. You got to think like the hospital and like their business as well. If you're running like I don't know what's like a machine, I don't know what machine that they use. It might cost like £200 a day. If they're doing that for 20 years, they want to cut down the cost, then they would say, oh yeah, you might want to consider euthanasia. Maybe it might be better.
yeah.
Like, you got to maybe think like business and politics and all that stuff, how that works, not just from the patient's side of view. And you think also about like the families and how they're impacted and how they will be grieving and all that. So it's not just for the patients, but just like the people who are also affected by it as well.
Mm,
No, that's a very good point, especially about when it becomes about money or patients' health. And I mean,
Mm,
that's already an issue, if we're being honest already, isn't it? With
yeah.
cuts down to medicines and
Mm,
just prescriptions and stuff. I'm sure there's been a lot of stuff, I think last year and stuff about it. So yeah, it's always an issue. Um, I don't know how it would work. I mean, we don't really know, do we? Because it hasn't happened in the UK. Whether it would be something hospitals deal with or whether there'd be specific clinics made for this. So it would depend on that, I would assume. But yeah, I do understand your points. It's a very difficult thing to talk about because it hasn't happened, and we can only assume stuff. But until it happens, we're still quite clueless on how it would work and what rules they would enforce and that kind of stuff. Yeah, there's two sides to it. Side where people have the choice and given the choice to actually be euthanized or to keep on going. And yeah, it's difficult. That's why I feel like this debate is quite of a it's there is no right or wrong answer at the moment. I
The
feel
grey
like
area.
yeah, because it hasn't happened per se. I know it's happened in other countries. I haven't done a lot of research into all of that, so I can't really
But
speak
also, if
about
it
it.
does work there, then there has to be a way of it working elsewhere.
That's true. Yeah, if
mm.
it's already out there in the world that's being
And it is
practiced.
working.
Yeah, yeah. I mean, it's not always gonna work, but
No, of course not.
no, but that's the same with anything.
yeah, I think
Mm,
Yeah,
there are people who go from like the UK to like countries like Switzerland
yeah.
just to get
Yeah.
it done. Yeah, there's no like common ground that people find with this topic. It's just sort of like a two-sided sort of thing.
yeah. I mean, because like society, we already like allow animals to be put down, as an act of kindness when they're suffering and stuff. So,
Mm.
like, why is that available to animals but not to humans? I mean, I know there is a difference between both, but it is again already out there. I mean, I know it'll be different because we're like higher up. Don't want to say it because it sounds horrible,
You know,
but we are. And that's the way society works, isn't it? With us being the top of the board. But yeah, it's already happening, and I feel like, euthanasia, it allows a person to die with dignity, and they're in control of that situation. It's a very private matter, death, and it shouldn't interfere with the individual's right to die. So it should be up to them. Them again, coming with the keyword choice again. But yeah, again, also when you mentioned family and friends suffering and stuff, but there's also the other side of it where this person decides to, and they're spared the pain of seeing their loved one just in this endless suffering and this long, drawn out death. So again, there's two sides to it, which, yeah, again, we get back to the grey area.
Well, I think that just concludes it then. So thank you guys for watching the debate. Make sure you guys like, subscribe, hit that notification bell. Leave a comment down below on what you guys think. Should it be legalized or not, and why? And suggest any other debates that we should do. And make sure to check out other videos and stay tuned for more. Bye.
Bye.
Bye.